Tiffany. I'm going to be your nurse today. How are you? Is it okay if I touch your arm real quick? Perfect. I'm just going to look at your name bag. Can you tell me your full name and date of birth? Perfect, Jane Doe. What's your birthday? Perfect. How are you feeling today? Good, okay. So I just got orders from the doctor. Just have all your meds, your daily meds that I'm going to come give you. So are you having any pain right now? No, no pain? Oh, you are having pain. It's a 4? Okay, perfect. Well, not perfect. We're going to try to get that under control for you. Do you have any allergies that I need to be aware of? No, no allergies? Okay, have you ever taken pain medication before? And have you had any problems taking it or any reactions, nothing that you were aware of? No? Okay, I just want to make sure. I'm going to wash my hands real quick and then I will be back to give you your meds, okay? So for video purposes, we're just going to be working over here. The first thing I'm going to do is I'm going to compare my MAR with my physician's orders just to make sure everything's correct. I'm going to go through my 7 rights. It's one of the main things I want to check for is the right patient, right route, right documentation, right dose, right medication, right reason, and then also the right time. 7, right? Right medication, right route, right dose, right patient, right documentation, and the reason. Yes. Okay. So got all 7 of those. So like I said, I have my physician's orders here, and then my MAR. And so first thing I'm just going to go through them, like I said. So we have, I'm going to move this over here for just a second. So we have morphine sulfate, and they wanted to give 15 milligrams. Morphine sulfate, 15 milligrams iron stat. Which I have here. Perfect. So I'm just going to put a little star next to my MAR and let them know that that's been verified. Then I also have ampicillin 375 milligrams IM. I have ampicillin 375 milligrams IM. Perfect. I have Lanoxin 0.125 milligrams PO. And then I have Lanoxin 0.125 milligrams PO. Perfect. I have NPH insulin 16 units and 9 units of regular insulin sub-Q. And I have 16 units NPH, 9 units regular, sub-Q. That's correct. Okay. I have Proventil 2 puffs every 4 hours while awake. Proventil 2 puffs every 4 hours while awake. That is correct. Acetaminophen elixir 650 milligrams, PO every Q4 hours for a temp above 100. I have acetaminophen elixir 650 milligrams, PO every 4 hours for a temp above 100. And that is correct. Okay, so the first thing I want to do, for video purposes, I'm going to just make sure I put my gloves on here. I'm going to pull my meds. I want to make sure that they're all going to work, make sure I have the right dose, and that my meds are not expired. So we're going to start with, for this video, I'm just going to do, I'm going to go through all of them, but I'm just going to do the injectables. So the first thing is morphine. So I know I have 2 different types of morphine here. I can either do the Carpijet or the Ampule. I'm going to verify both for this. In the Carpijet I have, let's see, 20 milligrams per 2 mLs, and it is not expired, so I know that I need to get 15 milligrams, so I know I can use this. Also in this one I have 20 milligrams per 2 mLs, which means I can use this one as well. Okay, and then for ampicillin, I'm going to give 375 milligrams. So verify here, check the star water. Verify expiration date, 10 mils. And for this one, I can mix it with several different levels, so it will work, and it is not expired. Okay, Yeah, and I did miss one on I still have my Physigeorge and my MAR. The TB test, tuberculin test 0.1 milliliters. I have the correct syringe for that. We're going to use for video purposes my sterile water. That is not expired. Okay, and then the Lanoxin, which I had here at one point in time. I'll verify that in the next video. And then my insulin, I have the NPH, wait. Okay, so the NPH insulin, I want to give 16 units of this, which is 100 units in here, so I know that this will work and it is not expired. Regulator, I want to give 9 units of this. There's 100 units per mml, which I know this will work for that, and it is also not expired. Insulin. Preventol, I'll check in the next video, along with the acetaminophen. Okay, so now that those meds are going to work, so the first thing I'm going to do, we're going to give all the stat medications, and then we're going to go to the now medications. For the stat medications, the first one on there is morphine sulfate, 15 milligrams. So I'm going to actually give my injection with the ampule, but I'm just going to demonstrate how to set up this nice little cartridge. Just going to sit in there. I'm going to twist this around. I'm going to hold the vial and just twist this in here. Okay, and then I would have to obviously attach a needle to give this IM. Other than that, it's all set up and nice, good to go. So I'm not going to need this anymore because, like I said, I'm not actually going to use that one. Okay, so the ampule is the one I'm going to use. Once again, I'm going to make sure I just have the right med here, and I want to give 15 milligrams. So there's 20 mils, there's 20 milligrams for 2 mLs. So I'm going to I already have my med math complete here. After everything's done, I'm going to end up giving 1.5 mils of morphine. Okay, so then I'm going to set this down here. And I'm going to get everything I need set up. I'm going to have a 3 ml syringe because I'm only drawing up 1.5 mils. I would also have another nurse verify this with me and watch me waste, which I'm going to do in just 1 second first. Okay, so there's that. And since I'm using an ampule, I'm going to use a filter needle because I don't want to inject glass into my patient because that would be bad. Okay. And then I'm going to, okay. The patient said that they had no allergies already. I've already asked about pain medication. This isn't with morphine. I've already checked my drug book. I know that it can cause dizziness, nausea. They can have vivid dreams. So all this is something I'm going to want to watch for. Respiratory depression if you give too much. So I'm just going to make sure we check the patient's vitals afterwards in this monitor. So I'm going to break this away from me. And then the glass would go in the sharps container. I'm going to set this down here. And I know I want to give 1.5 mils, so I'm going to use my filter needle. I'm going to be careful not to touch the edges. I'm inserting here. I'm going to drop 1.5 mils. I might drop 1.6-ish because I have some air in there. Okay. I don't necessarily need to recap this, but I'm just going to flip it here. And I would have another nurse with me right now verifying all of this. I have more than 1.5 and I have some air in it, so I'm going to get rid of that real quick. The air. And then also get right to 1.5. Perfect. So then this is where I'd be like, you can verify.
Mm-hmm. You got it right.
Actually, there's still some in here, so I mean, I've drawn it all up and wasted it, or I could just show them this and then get rid of this as well. So I'm going to put that in the sharps container. Say that was wasted with another nurse. There's 1.5 mils in here. So now I can't use the filter needle to inject. So I'm going to get rid of this filter needle, which will go in the sharps container as well. And then I'm going to use an IM needle here. Okay. And at this point, I'm just going to show you on the mannequin and all the areas that you can give IM medication. So one of them is the deltoid, so you're going to 3 fingers below the chromo process. You can give it there, make sure you have enough. Most people can pinch 2 inches there. And then the vastus lateralis, one of them, and then the greater trochanter, let me show you right here on the mannequin. So I'm going to stick my hand right here on the greater trochanter, I'm going to make a V right there, and basically kind of on the love handle, and I'm going to go right in between the V, making sure that there's enough padding there. And I meant ventrogluteal, not ventris lateralis. Wait, yes, okay. So I'm going to use this for the video. I'm going to pretend like the patient's deltoid. So I would take my alcohol, and I'm going to clean starting from the center outwards. Okay. And then I'm going to place my hand just to the side of the area where I cleaned, and I'm going to displace the skin syrup method, and I'm going to insert this needle at 90 degrees. Okay. 1, 2, 3. I would aspirate to see if I'm in a vein, which I am not, which is perfect, and then I would slowly inject the medication, leaving the needle in the skin for 10 seconds. Okay, and then when I'm ready to remove, I would pull out at the same time of both, would put my safety on my needle, and get rid of this in the sharps container. Okay, so there's my morphine. Okay, and then, so it's only have to be 1 IM injection for this. I'm just going to now show how to reconstitute my ampicillin. So, for ampicillin, you're wanting to give 375 milligrams. And it's about, like I said, you can reconstitute it with several different mils, but I'm going to reconstitute it to make 400 milligrams per mil, which equals, I'm going to add 7.1 mil of sterile water. And so when I did my med math here, I'm going to end up giving 0.9 mils of this medication. Okay, so the first thing I'm going to do, shut this down, I'm going to all my supplies together. Helps if you open it. Okay, and then I'm going to inject 7.1 mils of air into the practice vial, or the sterile water. First thing, I'm going to open both of these, and before I inject the air, I'm actually going to clean them both. And once again, I'm going to just do my second check here, make sure it's the right med that I'm giving and that it's not expired, which is still ampicillin and is still not expired. Okay, so there's that. Okay. So I'm going to put this in, inject the 7.1 mils of air. I'm going to flip it over here, keeping the needle below. Actually, just, okay, I can see it. And I'm going to just, in sterile water, I'm just going to drop a little bit more because I have some air in there just to make sure that I have enough. Quite a bit